It's me, Dr. Katina Kennedy, nurse practitioner, here with some health tips on how to prevent recurrent bacterial vaginosis and yeast infections. As we know, BV and yeast infections comes from when there's an alteration in the pH of the vagina. The pH, also known as vaginal temperature. So when there's a change, things can grow, okay? So the bad bacteria grow and the yeast can form. So some things I educate my patients on is, number one, wear your cotton underwear. It's important to keep it dry and cool down below. So if you wear your thongs, your lace, your satin, cute underwears, and you get recurrent BV or yeast, it's important to, wear your cotton underwears. Number two, Dove unscented sensitive skin soap. That's the soap that I know that does not have any fragrance in it. A lot of these other soaps, I always tell my patients, if it smells good, don't use it down below, okay? It's not good for you. It will change your vaginal pH. So anything that smells good, don't use it down below. So again, cotton underwear, your Dove unscented sensitive skin bar soap. Also, if you have frequent sex and your partner ejaculates inside of you, guess what? You're gonna get it recurrently, because sometimes, and it doesn't happen to everybody, okay? But most times this happens after sex. So if you notice that you're having this infection after sex, then you have to look at some of the things that's occurring during sex. So if your partner's ejaculating inside of you, that can cause the alteration of the pH as well. So if you're having frequent sex, I always tell my patients, you want to, have your partner ejaculate other places. Also, be aware of the condoms that you're using. That's important. Certain condoms aggravate us. Certain condoms change the vaginal pH as well. Also, maxi pads, your tampons, if you're using a lot of that has scent in it, it's not good for you. I also tell patients of vaginal probiotic. I know one in particular. There's so many out there, of course, so you can choose one, but Femdophilus is a great one that a lot of patients use to help keep the vaginal pH normalized. So Femdophilus is one as well. Also, if your partner is not circumcised, a large percentage of my patients come in with recurrent BV or yeast because their partner is not circumcised. This is the only time that you can pass BV or yeast back and forth, because bacteria and yeast lies underneath that skin of the uncircumcised male. So it's important that they dry really good around the penis and make sure they clean really good as well. And then they want to look at the soaps that they use as well. Make sure it's not scented. You look on the ingredients, and if it says fragrance in it, don't use it. All right, so those are a couple health tips that will help prevent the reoccurrence of bacterial vaginosis. Also, one more thing, if you do have a lot of oral sex, as far as the male going down on the female, or if you have the same sex partner and you're having clitoris stimulation, remember, we have yeast on our tongue. Naturally, yeast is on our tongue. So if you're having sex and oral sex is part of your daily or every other day sexual activity, guess what? Unfortunately, you may get the reoccurrence of yeast because you're constantly introducing the genital area to yeast from the tongue. So again, there's a lot of different things that can cause this. Drink more water. Look at the foods that you're eating as well. Stay away from a lot of carbs. But that's just a brief synopsis of what can cause recurrent bacterial vaginosis. And a lot of times, once you change those habits, you'll stop it. So take heed to some of the things I'm saying in this video. Have a great day.